this is Amy. Today, let's talk about gallstones. In our daily lives, we must be familiar with gallstones. But how are gallstones formed? And how can you determine if your pain is caused by gallstones and seek timely medical treatment? What dietary habits should you avoid to prevent the formation of gallstones? Today, I would like to share some knowledge about this. Please like this video and subscribe to my channel, and let's get started. Gallstones often occur in patients with cholecystitis. The symptoms usually include sudden and severe pain in the upper right abdomen, which usually radiates from the right shoulder or back. Additionally, there may be accompanying symptoms such as nausea, vomiting, and acid reflux. Cholecystitis and gallstones typically occur in individuals aged between 30 and 50 years old. So, how are gallstones formed? Analyzing the formation of gallstones and cholecystitis, we must focus on our dietary structure. Generally, the formation has a close relationship with stagnant bile and the changes in bile composition. Firstly, skipping breakfast can lead to the formation of gallstones. From 7 to 9 in the morning, the stomach begins its work. During this time, we should supply the body with the necessary energy by consuming food, and then, through the coordinated operation of the digestive system, distribute the energy throughout the body. However, if you skip breakfast claiming to be busy or not having an appetite, and remain on an empty stomach for a long period of time, the bile involved in the digestion process will start to undergo changes. The bile that cannot participate in the digestive work will stagnate in the gallbladder, forming a high cholesterol bile over time. Eventually, this excess bile that accumulates in the gallbladder can lead to the formation of gallstones. Furthermore, after gallstones are formed, the contractions of the gallbladder during its operation can easily induce biliary colic. Therefore, it's very important to have breakfast at regular intervals. No matter what excuses there may be, please do not miss your breakfast. Secondly, excessive consumption of greasy and heavy foods can easily lead to the formation of gallstones. The so-called heavy food refers to foods high in fat, cholesterol, sugar, and excessive heavy seasoning. Consuming this type of foods can burden the gallbladder. As we know, the body relies on the contraction of the gallbladder to release bile secreted by the liver to break down fats. Overconsumption of heavy foods requires the secretion of a large amount of bile for digestion. Over time, this can lead to abnormal cholesterol metabolism, bile stasis, and difficulties in digestion, resulting in symptoms such as bloating, poor appetite, and indigestion. For patients who have already developed gallstones, is it better to do surgery to remove the gallbladder or using traditional oriental medicine treatments? I'm sure the choice depends on individual analysis and preference. But one thing I want to mention is that the human body is like a complete microcosm, and each organ, like every individual in this vast world, has its own value. In the field of medicine, our approach to the human body differs from that of robots. It's not like replacing a faulty part with a new one. Even though the gallbladder may seem insignificant, it plays a crucial role as a storage organ for bile produced by the liver. Imagine if the gallbladder is removed, but the liver continues to secrete bile, and the bile has to directly enter the duodenum through the common bile duct to participate in food digestion. If your lifestyle and dietary habits remain unchanged, the liver will have to compensate for all the functions of the missing gallbladder. Without the gallbladder to store and buffer bile, all the stress is borne by the liver. This is why there can be complications like liver stones, hepatitis, and liver cancer. According to oriental medicine theory, the gallbladder is believed to have the task of coordinating the functions of the organs. Without the gallbladder, the functions of the organs can be severely imbalanced, leading to various strange symptoms which doctors often encounter in clinical practice. Besides storing and releasing bile, the gallbladder also plays a role in making judgments and decisions. That's why many people, after having the gallbladder removed, tend to become indecisive. Therefore, the gallbladder is not only crucial for our physical health, but also an indispensable organ for your success in career and decision-making. According to clinical experience in oriental medicine, acupuncture has shown to be a very fast and effective method in helping patients with cholecystitis and gallstones. This is a patient with an acute onset of cholecystitis, and from this image, you can clearly see that the patient's tongue is very swollen, particularly in the area related to the gallbladder. In the right image, taken after 20 minutes of acupuncture, there is a noticeable reduction in the swelling in the gallbladder area. The patient also said that after the acupuncture, the severe pain has largely disappeared. The treatment of cholecystitis with acupuncture and herbs is very rapid, but the speed of eliminating gallstones varies depending on each person's physical condition and the size of the stones. The human body is a very miraculous existence. For patients who have had their gallbladder removed, the issues related with the gallbladder meridian still persist, and it may even affect liver metabolism. Therefore, these patients who need to control their diet more and regularly undergo oriental medicine treatments to help with liver metabolism and eliminate stagnation. I hope everyone can spread this knowledge. Please subscribe to this channel and share this video. Together, let's help more people to stay away from diseases and suffering.